In this case that you're looking at, the tooth has just been extracted, basically checking the socket and going through the drill sequence exactly the same way as that if the tooth was not there at all. You go with the pilot burr and then you go with the final drill. And sometimes with the extraction site, the length tends to be a little bit longer. Usually in this situation, I tend to use maybe a 13 millimeter in length. Diameter, whatever will close up that osteotomy site or the extraction site. Once the implant is placed, you want to torque it down, and it should engage to close to 35 Newton centimeter or more. For most part, you should be able to achieve 35 Newton centimeter or more pretty easily. Usually it's the apical 1/3 that will engage onto the bone. And once you're able to achieve that strength, then the next step, usually in this situation, you can see there's not much bleeding. It looks good. So what we do is we take a cover screw and close up the internal chamber of the implant. And once we've done so, we use the omnivac technique to make the temporary for the patient. And this basically makes it a little easier and faster. And of course, the plastic shell, the omnivac, is pre-made. It's made on a patient study model. And as you can see, the acrylic is inside. The mold of the tooth is shaped. And once that's done, we adjust the temporary. And of course, now we'll remove the cover screw, and then we're going to place the abutment into the implant and also lock that down if we can, and then adjust the temporary. And what you see now is picking the right aesthetic abutment to use and then putting it down. And you can hand torque it to about 20 Newton centimeters, or if you want, you can torque it to 35 with the torque wrench. It's up to you. Most time after the placement, you want to check the occlusion. If it's minor adjustment, you can do it right in the mouth. If it's major adjustment, you should do it outside the mouth. Of course, use a lot of water because it tends to heat up. If it does heat up, the temperature can go down to the implant and cook the bone, which we do not want. Once it's the shaping is done, tissue looks good, and the area is cleaned up, place a little cotton in the screw hole. And so make sure we can retrieve it. And usually I just use some Cavid to cover the hole. And once doing so, place the acrylic temporary on top and do the adjustment. And the patient will have a temporary tooth there.